Good day, dear friends. With you is Natalia on the channel Dr. Savkina, on which I share personal experience and answer your questions. At your numerous requests, my dear subscribers, today we will talk about the problem of low pressure. I will tell you about the causes and consequences of low pressure. I will answer the question, does this condition threaten our life? And what to do with this nuisance? People with low pressure, as practice shows, are much less than hypertensive patients. Often the problem of low pressure is ignored by doctors. It's not accepted to talk about it out loud. Although the symptoms of low pressure not only cause discomfort for each of us, but in some situations threaten life, what pressure is considered low? The standard figures of 120/80 are not an indisputable norm today. In each specific case, the emphasis is primarily on the person's feelings. The diagnosis of arterial hypotension is usually made at arterial pressure figures below 90/60 millimeters of mercury. At a pressure of 70/50 millimeters of mercury, fainting conditions usually occur, and indicators of 50/35 are considered critical, posing a threat to the life of each of us. At such pressure, a coma usually occurs. What happens to our vessels when arterial pressure decreases? Correct, they expand. And what can we feel with you at low pressure? What symptoms indicate the development of hypotonia? I would like to note right away that each of us can have our own symptoms when developing hypotonia. Everything depends on the individual characteristics of the organism, the presence and accompanying and background diseases, as well as the influence of environmental factors. Most often, hypotonics experience changes in their overall well-being. Weakness, unmotivated fatigue, drowsiness, sluggishness appear, and in some cases, a lack of motivation for life. People leading a sedentary lifestyle often find themselves in a state of melancholy. The most common symptom of hypotonia is a headache. In this case, everyone describes the condition in their own way. Some complain about a throbbing pain in the temples. Some are tormented by pain in the left or right side of the head. Some complain about a pressing pain from all sides, as if the head is squeezed in a vice. As practice shows, quite often, hypotonic patients complain about dizziness, especially when staying in a stuffy room. This is a serious symptom that needs to be addressed promptly. In some cases, it can be a precursor to the development of a fainting condition. Therefore, when this symptom appears, you need to stop and assume a safe position. It's best to sit down and tilt your head towards your knees. Headaches in hypotonic patients are often accompanied by nausea, which is most characteristic of weather-dependent people, athletes, and individuals with a labile psyche. By the way, nausea with low pressure quite often ends up with vomiting. Many people note relief after it. Some hypotonics wonder, do constantly low arterial pressure figures pose a threat to life? Yes, of course. In some cases, a sharp decrease in arterial pressure can lead to an ischemic stroke. This is especially characteristic for elderly people with blood clotting disorders. There are situations when a person simultaneously, with a drop in arterial pressure, has a high temperature. This combination is an alarming signal, which in some cases may indicate the development of a bacterial infectious inflammation or intoxication. In this case, you need to immediately consult a doctor. What are the main causes of low blood pressure? First of all, it's insufficient physical activity on one hand and excessive physical stress on the other. It's a sharp decrease in the volume of circulating blood, which is observed in burns and hemorrhages. Decrease in vascular tone and anaphylactic or septic shock. Certain heart diseases, infarctions, heart failures, thyroid diseases, hypothyroidism, hyperthyroidism, chronic renal insufficiency and hypoglycemia, pregnancy and vegetovascular dystonia, inadequate or malnutrition, lack of vitamin B12 and folic acid, as well as head and spinal cord injuries. Do you know that a decrease in arterial pressure can be observed when taking certain medicinal preparations such as diuretics, alpha and beta blockers, antidepressants, and Viagra, especially in combination with nitroglycerin? The treatment of hypotension includes both general recommendations for lifestyle changes and direct treatment aimed at eliminating the causes of this ailment. To cope with the symptoms of hypotension, first of all, you need to get out of bed gradually in the morning, starting with stretching exercises to improve blood circulation. Secondly, avoid standing for a long time. Thirdly, wear compression stockings to provide additional pressure on the legs and abdomen. This helps improve blood circulation and raise arterial pressure. Avoid consuming caffeine in the evening and limit alcohol. This can help avoid dehydration of the body. You should eat often and in small portions, and also increase the amount of fluid and salt intake. If you consume more fluids, it will in turn increase the volume of circulating blood and therefore raise the pressure. If changes are detected in the thyroid gland and adrenal glands, it is necessary to visit an endocrinologist and discuss hormone replacement therapy. Pay special attention to what I'm about to tell you now. Familiarize yourself with the side effects of the drugs you are taking in your life. Possibly the cause of low pressure lies in the constant intake of certain medications. Herbal and medicinal preparations, which have toning and vasoconstrictive effects, are usually used from medications to combat low pressure. These are caffeine, gutron, ecdystin, heptomil, rontoril, cofetamine, and opilac, the main active ingredient of which is royal jelly. From herbal preparations, these are ginseng, Manchurian aurelia, Chinese schisandra, Eleutherococcus extract, and Eleutherococcus. When choosing a preparation in each specific case, you need to consult with your treating physician. With hypotension, it is useful to sit in a leg-over-leg position and squeeze and unclench your fists. People with low blood pressure are recommended to take vitamin complexes 3 times a year, containing vitamins C, E, B5, B6, calcium, and phosphorus. By the way, ascorbic acid, vitamin C, is also capable of raising blood pressure, which is considered its pathological effect. There is a medicinal product called Simtul, 20 to 30 drops of which need to be dripped onto a piece of sugar and taken 3 times a day before meals. Dear friends, the methods and ways to increase blood pressure that I have mentioned usually help in most cases. However, in the most difficult situations, it is better to seek help from your treating physician. You were with Dr. Savkina. Subscribe to my channel so you don't miss many new, interesting and useful videos. And be healthy.